My name is Gordon Harold. I'm newly appointed Andrew and Virginia Rudd Chair in Psychology and Director of the newly established Rudd Centre for Adoption Research and Practice. I think the first thing to say is that the Rudd Chair, the Andrew and Virginia Rudd Chair, represents a very unique initiative, both at the University of Sussex, but also within the United Kingdom, in that it's a position singularly directed towards advancing knowledge, scientific knowledge, practice improvements, and most importantly, policy developments around vulnerable children and families. The primary focus is to generate information around children who generically may be described as genetically unrelated to their rearing parents, so children who have been adopted, children who have experienced parental remarriage, children who have been born to, for example, assisted reproductive technologies. At no time has there been a greater need, or will the need continue, to provide evidence-guided practice and, one hopes, policy developments that promote more positive developmental outcomes for children. A lot of evidence suggests that the parenting quality that children experience is a very, very significant factor on their development, particularly their emotional development, behavioural development, and later academic development. A way of testing the question whether the environment has anything to do with development relative to the genetic factors the child carries is if we could look at associations between family environmental experiences and developmental outcomes where children are not genetically related to their rearing parents. And uniquely we can do that in the context of adoption-based research. Perhaps the best place to start in discussing outcomes or profiling outcomes is to begin by identifying the types of problems that we as a centre and I as a researcher in this area pursue. So anybody in the area of child welfare, child development will outline to you the quite poor state a large number of children, UK-wide and internationally, presently find themselves in. When I say poor state, if we take one projected statistic, that is that by 2020, according to the World Health Organization, depression will be the second leading cause of disability-adjusted life years, time lost to illness, internationally, greater than, for example, ischemic heart disease. So the origins of depression as an index of mental ill health is hugely important. I welcome the opportunity to work with colleagues in education, in social work, in medicine, in law, and of course within the wide field of psychology, where collectively we pursue questions that inform outcomes with respect to knowledge relating to child welfare and child development, but also that informs practice improvements, whereby we're empowered as a group and as a centre to confidently address and inform policy decision-making interests. One of the great opportunities for the centre is to benefit not only from collaboration within the University of Sussex and with colleagues in the United Kingdom, but also internationally. So for example, the centre will have immediate links with the Rudd Centre led by Dr. Hal Groteven at the University of Massachusetts, as well as Drs. Leslie Lev and Phil Fisher at the University of Oregon, who have a long track record, not only in adoption-related research, but most importantly in intervention and prevention efforts directed towards adoptive family contexts.